So one of the most common symptoms of gum disease are gums that are bleeding or red and puffy. Bleeding gums is a sign of gingivitis, and that means that the gum is inflamed, and that's usually caused by plaque accumulating on the teeth. When gingivitis is left untreated, many times it spreads deeper into the bone and causes a disease called periodontitis, and that's where the bone around the teeth is lost. Left untreated, periodontitis can result in the loss of the teeth. Typically, once enough bone is lost, the teeth become loose and start to shift. That's a pretty late sign that there's trouble. Interestingly, in smokers, there's almost never bleeding of the gums. Smoking suppresses the bleeding, suppresses the inflammation, but makes the underlying disease worse. A lot of people don't realize that there are significant health implications associated with untreated periodontal disease. Studies show that people have a 2 to 3 times increased risk of dying of heart attack or stroke from gum disease, and that's because when people have gum disease, the bacteria from the mouth get into the bloodstream, and some of those bacteria are capable of causing the blood to be more likely to clot. So a heart attack or stroke is when blood clots and blocks the vessel. There are increases in certain cancers in people with gum disease. Pancreatic and kidney cancer have a 62% increase. And perhaps most concerning is there's a significant increase in Alzheimer's disease and dementia in people with untreated periodontal disease. Any chronic bacterial infection, such as chronic Lyme's disease or periodontitis, will increase someone's risk of Alzheimer's disease and dementia. In animal models, if you take the spirochete, which is a bacteria we see commonly in periodontal disease, and put it in the brain, the animal forms amyloid plaques, which is a characteristic of the disease. So a lot of people sometimes ignore bleeding gums thinking it's normal. They say, well, my gums have been bleeding forever, it must be normal, but really nothing can be further from the truth. We see patients come in many times who have had bleeding gums for years and years, and after 1 or 2 treatments, the bleeding stops and never returns, and they're astonished that it was that easy. So if someone has bleeding gums, we always recommend that they realize that that's not a normal condition. If your hands bled, if your fingernails bled, if your eyeballs bled, if you had bleeding from your joints, you would think that's normal. So bleeding from the mouth is definitely not normal. The first step is to be evaluated by either your dentist or a periodontist. Periodontist is an expert at treating periodontal disease, and there's a number of things that we look at, and typically we get to the bottom of why the gums are bleeding. And the treatment varies depending on how severe the person's problem is. Some people need little more than a real thorough cleaning, learn how to clean their teeth more thoroughly at home, and the bleeding resolves. When the cases are more significant, people need what's called scaling and root planing many times, and that's where the tartar is removed from under the gums. In the most significant cases, people traditionally needed gum surgery, cut and stitch gum surgery. We don't do cut and stitch gum surgery anymore. I was the first periodontist on Long Island to start to treat periodontal disease with a laser using the LANAP protocol, and I was trained in that back in 2008. So I'm in my 11th year of using that modality now, and it's light years ahead of the more traditional way of cut and stitch surgery. There's no scalpels involved, there are no stitches involved, no reflecting the gum back from the teeth. So there's much less recession afterwards, virtually no discomfort after the treatment. Which is just terrific, and a lot of that just comes to how gentle and how precise the laser is, and also the fact that we're not exposing the bone in order to do that. So if you have bleeding gums, if you have loose teeth, if you have bad breath, which is another sign of gum disease, if your gums are red and puffy, I'd urge you to have your gums checked and not ignore those symptoms, because number one, they can result in the loss of your teeth, but number two, they can certainly shorten your life. So thanks for watching.